Hi, I'm Jen Guiver and I'm the Executive Director of People and Culture, and I've been asked to share a little bit about how I got to where I am today and my career journey. So as you can probably tell from my northern accent, I'm originally from the Wirral on Merseyside, and I grew up there with my mum, dad and little sister, and we've gone on to become quite the NHS family, with my sister becoming a neonatal nurse and my mum being a training manager. I don't think that was ever anyone's particular plan, but it's how things panned out. I went to the University of Nottingham and studied geography. Had a fantastic time and really enjoyed being in a new city and meeting lots of new people from all around the country. During that time I saw an advert for bank work back on the Wirral, and did some work in the HR department on bank. I was filing, I was looking at equality, diversity and inclusion audits, and I really enjoyed my time there. I think particularly I enjoyed being part of that NHS team and all working together for the benefit of the patients. When I graduated, I had no idea what I wanted to do, but I needed a job. I also wanted to stay in Nottingham with my boyfriend, who then became a husband. I applied for a few jobs in the NHS. It was kind of all I knew and all I really wanted to do, and I started at the Queen's Medical Centre in Nottingham as the Junior Doctors Liaison Coordinator, which was a new role that had just been put in place to support communication and pastoral support for junior doctors. So they would be doctors who just graduated and then joined the NHS as they were called house officers then, but F1s now, and right up to senior registrars. I used to organise communications, events outside of work, forums for them to speak with management, and it was a really good way to get into the NHS. I learnt an awful lot from the medical colleagues that I met during that role. I was based on the HR corridor, and I think I still knew that I wanted to get into HR, having had that experience back on the Wirral. So I started in medical staffing, which was called medical personnel back then, and worked my way up at the QMC and latterly became known as Nottingham University Hospitals. Had absolutely the best 10 years at Nottingham University Hospitals, met some amazing colleagues who I'm still in contact with now, learned so much about HR, from recruitment to medical staffing to terms and conditions, to disciplinaries, grievance and everything in between. But it was time for a bit more stretch and a challenge, and I applied and was successfully appointed to the Deputy Director of People and Organisational Effectiveness at Derbyshire Community Hospitals. So I headed over to Derbyshire. It was quite a cultural shock. I went from riding my bike through the city of Nottingham to get to work to driving my little mini around the countryside of Derbyshire and genuinely getting caught up in traffic jams of sheep and deer in Chatsworth. I had a great few years there, worked with a fantastic team, and the accumulation of that was we launched a joint HR team between Derbyshire Community Health and Derbyshire Healthcare Trust, and that was called the People Services Team. So we provided the full range of HR services to those two trusts. By that point I had one baby who was about 2, and I was pregnant with my second child, and the job of Deputy Director of People and Culture at Nottinghamshire Healthcare was advertised. I'm really passionate about the Nottinghamshire health system. As a resident of Nottingham, I enjoy giving back in my work life to our population, and the opportunity just seemed like the right one at the time. So I was offered this job just before I had my second baby, and we didn't know the pandemic was about to happen. So I gave birth on that Mother's Day when Boris Johnson told everyone to not visit their mothers, and lockdown happened the day after. I then joined the Trust on the 1st of January 2021 as Deputy Director of People and Culture. 18 months later, and after getting to know the Trust, building a really strong people and culture team, implementing a variety of different things during the pandemic and obviously supporting the pandemic response, my predecessor left the Trust, and I applied for the Exec Director post. So I started as Exec Director on the 1st of June. I'm 3 months in. It's been a whirlwind of 3 months, but I'm building a really strong team around me. We are in the process of drafting our first ever people plan, which will hopefully enable us to realise the aspirations within the Making a Difference strategy. We have got a whole raft of exciting things ahead. Some things of note are our new wellbeing offer. So we've got a really great staff wellbeing offer, and that's hopefully going to improve and go from strength to strength over the next few years. We want to make sure that the values that were launched just before the pandemic actually go into practice across the trust. So we're doing a big piece of work around values into practice. I'm also in the process of restructuring our learning and development department at the moment, and that will make sure that the offer that we have for you around your training and development is best in class, and will attract people to choose Nottinghamshire Healthcare as a place to work. So hopefully that is a little bit of interest about myself, both personally and professionally. I look forward to meeting you as I'm out and about on exec visits.